The doctor says all new.
I want to talk about something else on our list of top medical procedures. It's number 4. It's jaw widening for your children. It's a procedure that's often used to help keep children from having permanent teeth pulled. It basically creates more space in the mouth. But have you wondered if your child really needs to have this done?
Hi, John. So you know why you're here today?
To get the expanders.
Fantastic. He has a lot of crowding, especially on the bottom. There's a tooth that is coming in. On top, the upper jaw is not developing really well. So he's going to get an upper expander and a lower expander too. When we do the jaw expansion, the upper jaw actually gets wider, and we create more room for a lot of the permanent teeth that are coming in. This is the shape of the expander that goes to the upper jaw. Okay. There is a screw here. And where does the key go? The key goes right in the middle. You have to turn it. Then we check up on you on a weekly basis and make sure you know how to do it and you get it right. You ready? Let's roll. I'm gonna fit the bands. Okay, bite down for me. There you go. Open. One more bite. Perfect. One more time. Good job. So now I'm gonna try it in his mouth. See if it's fitting. Open up. We're using a light cure cement. The light makes the cement hard. You can't take it out, so it's all nice and fixed. I think we've got it.
Yep. I'm talking a little weird, but overall, it's not hurting.
Here to tell us more about jaw widening is Dr. Atoosa Nikaeen and her patient John. Welcome to both of you.
Thank you.
So before we see it in John's mouth itself, walk us through on those models what this procedure actually is.
We usually use upper jaw expander when the upper jaw is very small and narrow, and we widen it to open the space, usually for permanent teeth to come in, or if they have medical problems, like if they're not breathing well or have large tonsils.
As a parent at home, how would I know that my child's jaw is too small and I should bring them to the orthodontist?
So if you're looking to your child and he's snoring, or he cannot breathe well, or basically he has a mouth problem, or you look inside and the upper jaw is really narrow, you have to bring it to to the orthodontist.
Is there something you'd see with the teeth, the spacing of the teeth, that a parent could see
Usually
at home?
they're very crowded, and usually the upper jaw is really, really narrow.
And John's had his in place for how long?
He just got it actually on Monday.
Does it hurt at all? No? So you're fine.
They just have to put cotton there and air dry it.
Can we see what it looks like in there? Can you sometimes take some of the food and hide it up there for a late night
Save
snack?
it for later? No? So John, is this better than having a lot of teeth pulled later on?
Yes.
Yeah.
So it sounds like you support it, right?
Yeah. Oh yeah, I do. I send a lot of my patients to the orthodontist by age 7 just to take a look.
For the same visit, absolutely.
You know, my kids went through this. My daughter is now in the braces, but her braces are only going to be on for about a year at the most, and my son actually has his little jaw expander going on right now.
Well, fantastic.
Yeah.
Well, John, thanks for sharing with us, buddy. Thank you, John. Do you make your children have common medical procedures just because everybody else is doing it? Up next, find out if the top 3 procedures are necessary for your child's well-being. And then later, we'll be uncovering the latest Hollywood medical scares. Find out why they can happen to you and what you need to do to protect your own health.